Hello, welcome to CrossCurrents, produced by the City of Fort Collins in cooperation with the Larimer County League of Women Voters. I'm Barbara Rutstein, the moderator of today's program. Today we will now discuss medical marijuana dispensaries, yes or no, in Fort Collins. Medical marijuana was approved by the Colorado voters as a constitutional amendment in 2000. That was amendment number 20. This amendment created a limited exception from criminal liability under Colorado law for seriously ill persons who are in need of marijuana for specified purposes and who comply with the conditions set forth by the amendment. Since 2000, there have been changes made by the Colorado Department of Health, the Obama administration regarding the prosecution of those who use medical marijuana according to state law, and in 2010 by the Colorado State Legislature. The Fort Collins City Council, under the 2010 state statute, adopted regulations regarding the operation of medical marijuana centers. A group of citizens opposed to the operation of dispensaries initiated an ordinance to prohibit their operation in Fort Collins. The Fort Collins City Council has referred the ordinance banning dispensaries to a vote by the people of Fort Collins in November. It turns out that this is not a simple yes or no topic because federal, state, and local laws all apply. In an effort to try to explain the issue clearly, we have put together a panel that can explain the legalities involved and the reasons why voters might want to vote for or against changing the city's current regulations regarding medical marijuana dispensaries. We have our panel. On my right is Matt Cook, former Senior Director of Enforcement, Colorado Department of Revenue. On his right is Steve Ackerman, President, Northern Colorado Medical Marijuana Association. On his right is Scoot Crandall, Executive Director of Team Fort Collins. On his right is Ken Correia, owner of a center. And on his right is Justin Smith, Sheriff of Larimer County. Welcome to all of you and to our studio and viewing audiences. To begin, I would like to ask Matt to give us a summary of the changes that have been made in Colorado since the passage of Amendment 20. More specifically, the change from the caregiver-patient model, which was in the amendment, to the medical marijuana center model. That seems to be the essence of what we are discussing today.
Thank you, Barbara, and thank you for allowing me an opportunity to give a fair and objective opinion relative to this issue, and I'm glad that I'm started out on the right side of the issue. With that said, a real brief background about me may be in order. As introduced, my name is Matt Cook. I'm the former Senior Director of Enforcement for the Colorado Department of Revenue. I recently retired from the state service after more than 35 years of local, state, and federal law enforcement regulatory service. I was fortunate enough to be involved at the ground level with the legislation that was put in place, House Bill 1284. In fact, I'm the co-author of that legislation. Initially, in November 2009, a bill was dropped on my desk, and I was told that I was going to create a regulatory scheme to regulate the medical marijuana industry in Colorado. It was 29 pages long. Candidly, it had absolutely no regulatory tenets whatsoever. With that said, I spoke with the bill sponsor, Representative Tom Massey, who was gracious enough to recognize that I do have a regulatory background, and he asked me to take the pen and put it to the paper and craft something. I spent the next 3 weeks doing my regular day job and at night writing House Bill 1284. And in fact, I wrote the legislation from the First Amendment, the first strike below, forward, which ultimately that regulatory scheme was adopted. So I do know a little bit about the history and the evolution of that, and I will try and provide it in a fair and objective manner. I recognize there are two sides to this issue. It is a very emotional issue and can be a very heated issue at times. But as I said, I'll try and be as fair and objective as I can. With that said, I think it's important to understand really the evolution of medical marijuana in Colorado to really understand, or at least to answer this question, what's happened subsequent to the constitutional amendment. And I think it's also important to note that you referred to the caregiver-patient model that existed when the constitutional amendment was made. Well, that model still exists in Colorado today. As a matter of law, that's seated in the Colorado Constitution. And regardless of what happens with this issue here, whether a ban is chosen or not, that issue still remains. And that's a critical component going forward. With that said, in the year 2000, Amendment 20 was passed by the voters here in Colorado. And among other things, it created an affirmative defense for patients and caregivers who possessed 2 ounces of usable marijuana, 6 plants, 50%, or 3 of which could be flowering or producing a usable form of marijuana for medical use. There were also some exceptions to that were created based on the quantities that they had if a doctor allowed quantities to be used in excess of that 2 ounce or 6 plant limitation. The constitutional amendment also required the Colorado Department of Health and Environment to create a confidential patient registry to maintain patient and caregiver information, commonly known as the red card information here in Colorado. It prohibited anybody from accessing that information or any information about patients, the registry, or caregivers, with the exception of, obviously, the state health department employees and law enforcement, state or local law enforcement officials who had physically stopped somebody who was in possession of medical marijuana and claimed an affirmative defense and or had possession of a red card. What's important to note is that law enforcement, obviously having public safety concerns, do not have access to the registry as we sit here today. They merely have the opportunity, the ability to validate whether or not a person has a red card, no more, no less. And it's only in connection with a stop, in connection with probable cause and those kinds of things, law enforcement terms going forward. But in connection with an investigation, if they believe that a person may or may not have a red card, or maybe selling cannabis illegally, medical marijuana illegally, they do not have the ability to query that registry to determine whether or not that person has a card. They have to physically be involved with a stop in order to do so. From the passage of the constitutional amendment until approximately the fall of 2009, there were many businesses operating throughout Colorado. While nobody really knows the exact number, it's believed that there were several hundred of them that were in business, and they remained relatively, and I'll use the term, dormant. And when I say dormant, there really wasn't a high-level public safety concern or community concern about them because they were relatively dormant or quiet. With that said, in 2009, the United States Attorney David Ogden issued a memorandum which some have interpreted to essentially allow the use of cannabis for medicinal purposes with relative conditions, and that the federal government will maintain a hands-off position on this issue going forward. And it's been interpreted many ways, and I just give you an example. I'm not endorsing that specific position. I'm just telling you that was one of the positions taken. Nonetheless, it created an explosion of this industry, and it's due to a number of factors, and we can debate what those factors are going forward, but the reality is simply this. Local and state government and the citizens of the state of Colorado did not know what to do with these businesses. There was a huge public outcry to legislators, and as a result, a draft of a bill and a fiscal note ended up on my desk to implement a regulatory scheme. As I said, it took me about three weeks to write that the legislation itself, and in addition to that, there were some 20 regulatory mandates out of the legislation, and I put together a work group to craft those critical tenets going forward, and candidly to get buy-in from the community as a whole. It's important to know that I had district attorneys, I had the Chiefs of Police Association, I had the Sheriff's Association, Colorado Drug Investigators Association, I had Colorado Municipal League, Colorado Counties, Inc., I had local governments, I had regulators, I had doctors, I had local and county health officials, I had center owners, I had growers, I had infused products manufacturers, I had patients advocates, and patients participate. There were 30 of us that sat in a room for more than 5 months and crafted critical regulatory processes to enable this legislation to go forward in a smooth, efficient, and fair manner.
Okay, so my question then is, the legislature told you to do this?
That's
Is that
correct.
correct?
It was
Okay.
not my decision by any stretch of the imagination. I was a public servant, and it was dropped on my desk, and I was asked to use my expertise to craft it, and I take my job very seriously.
Okay, okay. Now, let's come to today. Is that what we have today, and that's what we're working under?
It is, but there's some significant differences between the patient-caregiver model, as you've referred to it, authorized by the Constitution, and House Bill 1284. And what I'd like to do is to go through some of those technical nuances and point out the differences between the before and after, the then and now, however you choose to look at it. But I think, again, it's also important to note that the caregiver model still exists. It's just that in connection with this regulatory scheme, we identified 1,100 businesses throughout the state of Colorado. 99% of those businesses adopted for the regulatory scheme for a number of reasons. First and foremost, it validated their business, and it created the ability for them to do business under the statutory scheme with constitutional protection, at least in their mind. The two are very separate and distinct, and it's also important to note that. But along with that, it created a mechanism for us to validate the business and also address the traditional public safety concerns through a very transparent process. And I'll describe some of those differences as we go forward, if I may.
Okay, okay.
Thank you.
So that you're saying that the caregiver patient model still exists?
Yes, ma'am.
And do they have the same regulations that the dispensary model would have?
They do not, and I'll point out there's significant differences between the two, and if you'll bear with me, I'll go through those for the benefit of
Okay,
the
well,
audience.
wait just 1 minute. Is there anyone here on the panel who would like to ask a question of what Matt has said so far? Yes.
I would. Matt, you indicated and you used the word dormant for a number of years. I would suggest, and perhaps would you clarify the word dormant to be effective? It was an effective model that was working. Dormant to me implies some sort of non-effectiveness, whereas it's my understanding that it was a relatively effective model meeting the needs of those registered patients.
Go ahead.
If I may, it wasn't that, and I'm not in a position to tell you whether it was effective or not. What I am in a position to tell you is that because they were located in residential neighborhoods and because of the number of them, there was a huge public outcry as to what to do with them. They were not a regulated business at all, and in fact, there are a number of reasons for that because of the constitutional protections that are afforded caregivers, and I'll describe some of those going forward.
Okay, go ahead.
However, you did indicate in your comments that there wasn't a whole lot of problems associated with the caregiver model for approximately 8 years. Would that be accurate to say that for the 8-year period from the passage of the amendment in 2000 to the changes that you delineated, it was a relatively calm period, and whether or not the needs of patients were being met is not within your purview, but however, it was incidental in terms of crime and other problems in our community. Is that correct?
Sure, go ahead.
If I may, I didn't look into the reasoning behind the public policy decision that our General Assembly made. My charge was to create the regulatory scheme, and that's what I did.
Okay, and what about the sheriff's office? What did you have during that period?
What we experienced from 2000 up to 2009, when the now famous Ogden memo came out, was really no change in behavior in the community. We had a limited number of people who were on the registry in Larimer County. I believe it was about 500 up through that period of time, and we didn't see significant issues. My deputies rarely ran into issues with marijuana, was listed under medical marijuana. And truly, it wasn't until the Ogden memo when Larimer County, people should know, went from 500 registered patients to 8,000 in a year and a half. So in the first 9 years, 500 people, and starting in 2009, it's gone up to 8,000. We looked at that. We didn't see anything that's changed in the community as far as medical patterns, people injured more, more cancer, more glaucoma, more AIDS, the things that were typically listed. And we talked about dispensaries. What we saw was dispensaries showed up. Dispensaries showed up. We saw a 16-fold increase in the number of users. Since then, we've seen robberies, we've seen burglaries, we've seen home invasions on a level we had never seen before. And all I can tell you is the change that happened wasn't medical marijuana, because we're not talking about medical marijuana here. We're talking about the dispensary model. When dispensaries were allowed through the federal change and then the change in interpretation with the state, we saw a significant increase in use, and we saw a significant increase in crimes.
Okay, the only thing that I'm wondering about is I have some statistics that show as far as arrests, the highest year was, let's see, 2003 with
Yes.
422. And then 2010 was the fourth highest with 314.
What are those arrests for?
What was that?
What are the arrests for? What's your data from?
The data, I think, came from your office. I'm not
Okay,
sure.
well, yeah, I need to know what arrests you're talking, because what I'm looking at, what I've gone back and looked at was the impact of medical marijuana. Crime in this community has steadily gone down for almost the last 10 years. However, once dispensaries arrived, we saw incidents or offenses where we were called out and our deputies were involved in an incident where marijuana was in some way related. These aren't necessarily all offenses where marijuana was charged, but they showed up and marijuana was a factor because it showed up either in the dispatch notes or the records. Those increased by 20% in those 2 years, actually 3 years, from 2008 to 2010. At the same time, crimes in general went down. And with these dispensaries in Fort Collins, we looked at that same data relating to marijuana-related offenses or incidents. In Fort Collins, they went up 40% during that period. So that's what we've observed.
Okay, I only know the statistics that I have here. and
Overall
so-
arrests, yes.
Yes.
If I may, Sheriff, I respectfully disagree with your interpretation of medical marijuana. It is defined in Title 12, Article 43.3, so it is a statutory tenant.
We're looking at difference. Medical marijuana was what was passed in 2000. Dispensaries came in 2009. There was the difference. Does anybody else tell me 16-fold what happened in our community that people became 16 times less healthy, that they needed the medical marijuana, except for the fact that we allow commercial sales at this point?
Okay, okay.
I have a question for,
Yes.
for Justin Smith here. My statistics show that from the fiscal year of 2002 to 2003 to the fiscal year of 2009 to 2010, drug filings and theft filings were the two most common filings in Larimer County. Mm-hmm. The reason for the 25.1 decrease in overall crime filings is due to the 44.7% decrease in drug filings. And this was taken off your website.
Between which years?
From the fiscal year of 2002, 2003 to the fiscal year of 2009, 2010.
And yeah, what we're looking at is marijuana. We're not talking about meth. Nobody's opened up cocaine dispensaries. We're talking about marijuana. And we look at the instance. The problem I see is when marijuana is related to other offenses. Oftentimes we're called because of other problems. Thefts, burglaries, robberies, assaults, and they're related to marijuana. That's what's coming up. And that's what bothers me is while we've been effective bringing other crimes down, that we've seen marijuana become more and more prevalent in our community and other crimes that are occurring.
Okay, Steve?
Could you explain, Sheriff, what marijuana-related crime might be in your estimation?
We're looking at any crime when we're called out by the community and people call for
Does that mean
anything and
somebody-
everything.
I'm sorry.
Where they mention that marijuana was some factor in that. So it runs the gamut, and that's the concern, is the overall incidents where marijuana is related. They didn't increase from 2000 to November of 2009, but at that point on, we saw a significant increase. And I would ask, have you seen things that explain that other than the introduction of dispensaries?
Explain what, excuse me?
The 20% increase we saw in marijuana-related incidents, and the 40%.
Well, I
the
still
city
don't
of Fort Collins
understand
saw.
your definition of marijuana-related incidents. That means that it's a crime that occurred where somebody might have been in possession of marijuana
Well,
at the same time?
What we're
concurrent
looking
with
at,
that?
what we looked at was doing a search of our records between the dispatch records that come in and the police reports. If the word, we just basically did a search when the word marijuana was mentioned in there as a factor. It was some factor that was included. The percentage of incidents we had, while total incidents and crimes were not going up, you're correct. the ones that involved marijuana did go up by 20% in the
But-
county and 40% in the city of Fort Collins, where the majority of these dispensaries are.
But marijuana was not the cause of the crime, it was just incidental to the crime?
I can't tell you on each one. We're looking in the range of about 500 of those a year, so I haven't had time to go through and see what each one of them
Okay.
is.
So that
I just
20,
look at the overall.
20% could be skewed a little bit. It's not, you're not saying that marijuana caused the crime. You're saying that
I'm saying it was involved. It was involved in
at
reasons that
the scene of the
citizens
crime.
called
Okay.
us, or we got involved in some kind of a criminal
Okay,
incident.
thank you.
Yeah.
Okay, any other comments on that? No? Okay. So now I think maybe we ought to talk about the difference in the model, the patient model and the dispensary model.
Thank you. I'm happy to do so. One of the basic tenets of House Bill 1284 is that it created a medical marijuana center license. And in connection with that, almost all the caregiver facilities, the 1,100 that were identified throughout the state, and they're listed in the fiscal note attached to the legislation, applied for licensure. And the legislation did several things. And as I said, at the same time, I'll give you the differences between the statutory tenets and the constitutional amendments, or the constitutional provisions. First, it created a license, and it's unlawful to operate without a license. There is no license that's needed for a caregiver. That license is unique to a person and a place. It's not something that can move. Unlike a caregiver does not have to meet any suitability determination whatsoever to do business. There are 20 specific tenets in the legislation that to be a licensee you must pass. And I'll give you a few of those. You can never have had a drug conviction throughout the history of your life. Cannot have been convicted of a felony in the past 5 years. You must be current on all your tax obligations. Any other government obligations going forward. You must also be a resident of the state of Colorado. None of those tenants are required to be a caregiver in the state of Colorado. Caregiver is an unregulated model by the Department of Revenue, and it's not part of the statutory scheme. With them came a license, and for any violation, the license can be revoked. In addition, licensing authorities, local governments, as well as state governments have the ability to levy fines upwards of $100,000 for any violation of the law. These businesses are also taxed. They pay sales taxes on all their sales. We also created restrictions for the physical location of these businesses. They have to be at least 1,000 feet from a school, an alcohol or drug treatment facility, the principal campus, university, principal campus of any college, university, or seminary, a residential child care facility, or drug treatment facility. Legislation also allowed local governments the discretion to reduce or eliminate many of these requirements going forward. They must also be in compliance with zoning, building, and fire codes. And caregivers were not addressed in House Bill 1284 with this legislation. The legislation also eliminated the Fourth Amendment protection for those holding licensees. That is, the legislation authorized 24/7 web-based video access to the systems, to the businesses by the regulatory arm of the state government, and it also allowed 24/7 access by law enforcement for any reason at all during any apparent business activity. There is no search warrant needed, no probable cause. They have the absolute right to be in these businesses at any time for any reason. They do not, however, have that same privilege with a caregiver. They must have probable cause, reasonable belief to believe that a crime has been committed. They must get a search warrant. There are certain conditions law enforcement tenants, if the evidence is going to be destroyed, fresh complaint, those kind of things, that can create exceptions to that. But generally, it's a different threshold altogether.
Okay, now let me interrupt you. Have you investigated any dispensaries with this 24/7 access?
The dispensaries we're looking at are the ones in Fort Collins, so we really don't deal with those. What I would like to point out, Matt touched on something that's important. He was a agent with the Department of Revenue. The Department of Revenue's job is to collect as much revenue for the state of Colorado as they're legally allowed to. That's, and he mentioned regulatory scheme. What the state did, we're talking about a green industry. This was green because it was marijuana and money for the state, and a significant amount of money collected for the state of Colorado. That was their job going into it. Matt has since left that and gone into a consulting business based on his success there. And so when you look at that, we have to follow the money. This is about the money. The state got involved. The state has an interest, and Matt hit it. They don't regulate those in the caregiver model, and I would offer them to show me problems that occurred originally with caregiver. They regulate on the commercial sales because the state of Colorado makes significant money off of that, and they have a definite interest in it going to commercial sales because they get money.
Okay, but
May-
have you
May I
used
add,
that?
so does the county and so does the city.
And they collect
coun-
sales, they collect some, how much
county-
sales tax?
The county sales tax and the city sales tax last year combined were a little over $250,000. Excuse me, a little over $270,000.
Yes, and that's where the state got into it because they could make money off that. And the same thing, the city of Fort Collins, they make significant money. Now, the question is, because the argument's been made, we should legalize, we should have dispensaries because we collect tax money. I would ask, it's my understanding, Matt, when you came here before, you mentioned there would be up to 9 agents hired by the state to work out of Fort Collins. My estimates, that's between probably $600,000 and $900,000 a year for those regulatory agents just to cover the cost of employing them to follow the dispensaries. Is there truly any money made off of it if you believe that's a motive to do, or is it merely paying for the cost of the revenue agents?
Yeah, what I wanted to know is if you used the regulation that he mentioned to investigate any of the dispensaries. If
What we, under the current model, we have not had a lot of involvement with the dispensaries. The ones we're talking about are the ones in the city of Fort Collins, and primarily they've dealt with that. I can tell you, these regulations are completely confusing. I believe the intent of the ever-changing regulations was to confuse those who were supposed to enforce them as to what they were. We're as confused as those in the businesses are these days as to how they work. I can tell you, we have seen, despite what we're told, that these regulations work, we still find this marijuana coming out of these stores that we're told is for medicinal purposes ends up in the hands of people who aren't supposed to have it. We see that and continue to see those cases rise.
Okay, Steve, you run a dispensary, right?
I do.
And have you ever been investigated, or have they ever come in and looked at your dispensary?
We've had officers from the city of Fort Collins come through our dispensary, or center as they're called, and I think it is early in this regulatory scheme I don't think that it's developed to the point where we are being watched daily, but we are all licensed, and we all have a license to have suspended or revoked if we do not follow the rules. So.
Okay. Matt, did you have a response that
I
you
did.
wanted to give?
I did, because the sheriff is absolutely incorrect in a few of his statements. The state of Colorado did not implement this regulatory scheme to generate revenue for the state of Colorado. The state of Colorado implemented a regulatory scheme to regulate an industry that was otherwise not regulated by anybody. And there are a number of reasons for that, and Sheriff, you've asked me for that, and I'll give those to you. The constitutional amendment, Amendment 20, required that law enforcement, as I said, have probable cause search warrants to go forward. Any action that they took required a seizure of evidence. In connection with that evidence or plants, it required that those plants be kept alive. As you know, when things go to court, they're generally not, court actions are not completed in a few months, which is generally the life of the plants. And there's huge liability, or was huge liability, as determined by the Colorado courts, pertaining to the plant value themselves. In fact, some of the courts in Colorado have determined the plants are worth $6,000 a piece. If they die, there's liability attached to it. And in that interim period, there was hesitancy from law enforcement to enforce the law for that reason. There was hesitancy from the Colorado District Attorney's Office to prosecute because they didn't want the liability. And as it relates to the regulations, I have to tell you that the former Larimer County Sheriff, Jim Alderden, was a participant in that process, and along with the Colorado District Attorney's Council, along with the Chiefs of Police Association, along with the Sheriff's Association in Colorado, all endorsed the validity of those rules going forward as a fair and equitable regulatory scheme.
I would offer, talking to Jim Alderden, that he and the district attorneys they took the best deal they could get out of what was being pushed at them in the regulatory scheme. The ones I've talked to did not like it. from the standpoint of, once again, it was placed not under the Attorney General's office and the criminal justice folks in the state. It was placed under the Department of Revenue. I know in my experience, I've not dealt with marijuana revenue agents yet, but I've dealt with alcohol revenue agents. And they tell us when they come to do enforcement, they said, you know, you guys are really responsible for community safety and what goes on in your community. Our responsibility deals with assuring that the state's revenue is fully realized through these. So it was placed under the Department of Revenue for a reason, and that had to do with the collection of taxes.
Okay, go ahead,
I have to
Scoot.
interject quickly.
Okay.
Because I come from the Department of Revenue, and I was the director of the Alcohol Enforcement Division for 30-some years. They regulate an industry, and I will tell you that in my entire career, not one time did I ever pursue a tax collection. The medical marijuana industry came under the regulatory purview of the Department of Revenue because we understand regulatory processes as opposed to the Department of Regulatory Agencies, which is essentially a perfunctory operation. The Liquor Enforcement Division investigators are not tax collectors either. That's not their mission. They never have been tax collectors, and there's a separate criminal tax division, the Department of Revenue, that does tax collection. You say that three-letter word around me, and I run the other way.
Okay, let's get to
I
Scoot.
can only tell you what they told me.
I just have
I'm just setting the
a
record
quick
straight.
question for you, Matt, and I'm curious about this. Do you benefit in any way financially from the continuation of the dispensaries? Do you have any profit in this through your consulting work? Is there any financial gain for you if the dispensaries continue?
Sure.
Yes. I am a recognized national expert in this regulatory scheme. There are 16 states in the United States that are looking for my consulting services. I also consult to a number of trade associations and industry people, as well as local governments here in the state of Colorado. In fact, I chair the medical marijuana work group for the city.
So the answer to that question is yes. You do
Absolutely.
benefit financially with the continuation of the dispensary model will in fact benefit you financially.
Of course it will.
Thank you.
Okay, let's talk about what effect these changes will have on patients. I think that's part of something that we're talking about. It's medical marijuana. There are patients involved. If we go to the caregiver model from a dispensary center model, what do we expect to happen to patients?
I think that actually the patients benefit more from the regulated, safe, and secure access that is provided by the medical marijuana centers in the regulated model, because the centers are able to carry a wider variety of strains which are used to treat different medical conditions. A caregiver is not able to carry a very large amount because they grow in smaller quantities. They only are allowed to have 3 plants that are mature at one time, whereas the regulated ones can carry more strains. The patients have the ability to go into a store that is in a commercial location that is safe and secure because it has burglar or security alarm systems. It has closed-circuit cameras that watch everything that goes on inside the store. All of the medicine has to be locked up in a bank-grade safe at the end of the business day, among other things. One thing that a caregiver, in most cases, and this is my concern, caregivers are not necessarily accessible either, and all of these commercial buildings are accessible, which is an important thing for people that have debilitating medical conditions.
Okay, yes, Scoot?
I would like to comment on a couple of things there. It's our understanding there are 16,000 registered caregivers in the state of Colorado. I would suggest that there are plenty of registered caregivers that can provide the needed services for these patients. It's curious regarding patients. I think, let's be honest, for the first 8 years of this system, we had approximately 5,000 registered patients. In 2009, when things, to use the words of Mr. Cook, exploded, that number went up to about 130,000 registered patients, on average about over 1,000 applicants per day. I'm just curious, from a public health model, what was the variable that came into play where we had this epidemic of pain? We have most of the patients that are registered are on average 40 years old, 69% of those are male, 94% of those patients claim severe pain, which we all know is an undiagnosable condition, and 6% maintain the need for medical marijuana under the defined amendment for cancer, glaucoma, AIDS, and other debilitating illness. I'm just curious, from a public health concern, why was this not investigated when we had what appeared to be an epidemic of pain in a 2-year period, and those needing treatment through medical marijuana? I think it's rather obvious.
Oh, I'd like to answer that, Scoot. I believe that along with the Ogden memo in 2009, not only did it bring caregivers such as myself into the light, because I felt a little bit more comfortable being a family man. I'm married, I have 4 children, they're in the schools here, and we look to protect them, and we believe that the only way to complete a safe, regulated model is to be in a center environment. And when we experienced that, I believe that patients had experienced that. There was somewhat of a fear to use cannabis as an alternative medicine, and along with the exception of the centers, after that memo, I believe that opened up the exception for a lot of patients to come out and use this, and it's been very effective and helped many, many people in this community, and I hate to see that go away. And I also have a question for you. You state that there's 16,000 registered caregivers in the state. How many of those are in Larimer County? Do you know?
I don't know that.
How many in Fort Collins, which is what we're really talking about here?
I don't know that.
And I think you touched on some things. We're hearing words like cannabis. Now we're talking dispensaries or centers. In 2 years, we've seen this industry reborn and with more reintroductions than Lady Gaga. They started out as medical marijuana dispensaries. They become centers, and now you've said we're going to call them cannabis. Well, what you're talking about it being like a pharmacy. I can tell you, my father was a pharmacist. I grew up in pharmacies. I know how they operate. Here's an example of what we see in the community. Kush, Colorado's premier cannabis lifestyle magazine. We don't have lifestyle for heart medications, lifestyle for other pain medications. And this publication is full of different dispensaries or whatever they're called for the day, talking about great deals on the marijuana, showing all kinds of kid-like images, cartoons and things. I don't see that as medical. I don't see that as a medical business. These aren't in pharmacies. Why has there not been a push to use pharmacies, use the FDA, use the same processes? You mentioned the different kinds of drugs or the different kinds of marijuana, and I'm curious what Buddy mix, it's Chex Mix with chocolate, what illness does that one treat? We came across that when we took off to somebody who came to Fort Collins from out of state just to get it, and we caught them yesterday with that, and they admitted they got it through a friend, through a dispensary. These were taken from a robbery in a recent dispensary. These are badass brownies and cannabis Krispies that look like Rice Krispie treats. What illness do those specifically treat? I would offer it promotes a lifestyle is what it promotes. It makes it fun.
I disagree.
I
it
do.
doesn't promote a lifestyle. The edible form of cannabis is the most effective delivery method. When we have patients that come to see us, we don't recommend that they smoke cannabis if they haven't come with that in their history, if they've not used it before. It is much safer, and there is less side effects for someone to ingest it.
But
Cannabis also
and we've
needs to
seen this
be-
in cookies, where kids in the Denver area ate cookies at their parents' house. They're infused with marijuana. We're not talking
I
about an
suggest
adult
those
food. We're
parents
talking
are
about
not being
candy.
very
Wait, one at a
responsible.
time.
Go ahead.
Well, we're seeing, when it's called badass brownies, I'm sorry, that's not promoting the kind of medication I remember. We talk about the different kinds. When you go in and see the names of them, we've seen this development of the industry from the 420 party industry when it came in, and we saw a very significant shift when there was a citizen discussion about putting this on the ballot, and those that were in the pot shop industry honestly began to reform, and we saw the marijuana leaves come off the sign. We saw green crosses come up. We talked about medicine. They've got better marketing than I'll ever imagine. The money from out of state. This is a David and Goliath issue with the citizens of Fort Collins versus the outside pot industry that wants to get into Fort Collins, wants to get into Colorado. They see their foot in the door for legalization. And I can tell you, 2006, the last time this won the ballot, it lost 60-40. And what we're not talking about is the true medical model. We're talking about dispensaries to push pot out, and that's what we're doing. I sat in here and saw the people that came down when you want people to see who your customers were. I went out to look and see who those people were that actually shop at the dispensaries. I didn't see the people that you brought in here to show off to the community and show off to the city council. I saw a lot of young people riding bicycles, running in. I saw kids go in, buy marijuana from the dispensary, get in their car with their friends and drive off. We saw a guy within the last 2 weeks that came in, his card didn't list that dispensary, and he bought marijuana. He was contacted afterwards. He acknowledged he didn't get it from there. And you know what he did afterwards? He went back to that same dispensary one more time, 2 more times, to that same, what you talk about is the responsible dispensaries in Fort Collins were selling to someone who they weren't regulated to do. The guy even changed his clothes the second time in 2 hours to buy more pot.
I've got to
Okay.
stop you here, Justin, because just right on that point, on that red card, the person or the center that is named as their caregiver is not necessarily, or they don't have to buy from that place. They can buy from any center anywhere in the state of Colorado with that red card, no matter whose name is written on that. As
Okay,
long
then-
as
Those change-
as long as the patient's name is written on that card,
Well, let's
and they
talk
have
about
a
him going
valid
back
photo
twice.
ID.
2 more times in the same day. I've never gone to the pharmacy for the same prescription
Do
3
you know how
times
much
in one day.
how much did he
Didn't you take
buy
the first
each
one?
time?
What's that?
How much did he buy
Yeah.
total?
I don't know what those amounts were the
Okay.
next 2 times.
Well,
He went back
you're
twice.
allowed to buy up to 2 ounces in a
So he-
7-day period in the city of Fort Collins.
How many joints are in 2 ounces? Couple hundred, 300?
Yeah, I would like to know, can a person
I
with
mean,
a card
honestly,
go
how many?
repeatedly?
28
About
in 1
60.
ounce.
How many?
About
28.
60 maybe?
28.
28 or 60. We're getting very
In
different.
1 ounce. you have-
28
In one
ounce.
day, he went back 2 more times to buy. 2 more times. Is that really somebody going to their pharmacy? Or, let's be honest,
Well, it
is that
sounds
somebody
like,
going to
sounds
the
like you're
pot
doing,
shop?
sounds like you're doing your job. Did you arrest him?
We charged him, absolutely.
Okay.
What I'm asking, we were told here, the city council chambers, that the dispensaries were on the up and up, and they were watching this. We also saw, they're supposed to be Colorado residents. Is that correct, Mr. Cook?
Yes, go ahead.
If I may, there is no reciprocity agreement with Colorado. To have a red card, you must be a resident of Colorado.
In that same day, a Texas resident came in, a Wyoming resident came in, and came out of the dispensary with their bags. These are the things we saw in a 2-hour period, 2 hours in
Did he
one
have
day.
did he have a red?
I don't know what they had at
Did he
that
have
point.
did he have
but
a
if they're
Colorado
supposed to be
registry
residents-
card?
I can't tell you that right
Okay.
now, but I can
Well,
tell you
that's
they're
important
coming from out of
information
state.
here,
I can tell you the
Justin.
folks that got the marijuana yesterday and had that package that I showed, they didn't, and they admitted they got it through a friend, and they came here specifically to get it. We've become a magnet.
We
and
need to
that's not
tighten-
what
we need to
our
tighten
kids
that
deserve
stuff up.
better.
For
Okay.
sure.
What
That
I
stuff
want
needs
to
to be
know is if a person has a card, can they go to one of the 20 or all of the 20 dispensaries that we have in Fort Collins? Could they start at whenever the dispensary opens and just go all day long and get whatever the minimum or the maximum is?
Unfortunately, that is the case at this point, but that is totally against the law.
Okay?
If I may, a few points. But to answer this question specifically, the patient simply needs to have a red card and one of 4 forms of ID. Valid driver's license with a photo, valid state-issued ID with a photo, military ID valid with a photo or passport with a photo, and the red card in order to purchase medical marijuana at any licensed center in the state of Colorado. Colorado Department of Revenue has spent money through its cash fund, not 1 penny of taxpayer dollars. You and I will disagree on that, but it's okay. I have something we're going to agree on in a moment. With that said, the Department of Revenue is building a proprietary system that ties all visitors together, and they have begun asking for patient numbers, and they're creating a database to ensure that patients have only chosen one primary center, which is what they're authorized to do. The primary center is the only one that has the ability to stick the 6 plants in the ground for the patient in the state of Colorado. With that said, all the purchases will be tracked when the system is up and going. There were promises made through the Information Technology Division in the state of Colorado that this system will be up and running by July 1st of this year. And unfortunately, I lost control of the Information Technology Division July of last year. They became an autonomous standalone division, so I don't have the ability to tell them, sit in that chair and develop this program. And unfortunately, they have not met their deadlines. It is, however, due to go online on January 1st. If I may, I'd like to address the advertising issue and the name.
I would like to raise an objection, Barbara,
Sure.
in terms of format. It was my understanding upon invitation that this is going to be a conversation amongst folks that had a stake in our community, to our voters. It's a little concerning to me that Matt presented himself as an unbiased representative. However, it feels very much like, and I would suggest it feels very much like to the folks at home, that he is advocating strongly and has virtually dominated this discussion this evening. It
Oh, I
concerns
would
me a bit.
disagree with you. I think
Okay.
I've given the sheriffs ample time to answer. And the problem is the regulations are extremely difficult to understand.
I agree.
And so we made a decision that we would have someone here who knew the regulations. If he appears to be advocating for them, I'm sorry, that is not our intent. Our intent is to try to understand the regulations and then how they relate to the initiative.
Didn't mean to offend you, Barbara, in any way. I was commenting on what my perception was. We have about 10 minutes left, and it feels very much like this has been dominated by a regulatory discussion, and we have yet to really hit on some of the issues that are facing our community as they make this decision around dispensaries.
Okay, but we're talking about the initiative, and I think the sheriff has done a very good job in talking about the problem of youth, the problem of what he sees as criminal behavior. What is it that you would like to bring out?
Okay, thank you, Barbara. One thing that we can agree on, and we have agreed on, the three of us have agreed on, sitting at a table, was that we were concerned and agreed that marijuana should not be a part of the lives of young people. Ken and Steve and I sat together, and that was an agreed upon conclusion. Marijuana has no place in the lives of a young person. At Team Fort Collins, our primary mission is to encourage young people to live a substance-free lifestyle. Since the inception of the dispensary model in our community, we have seen a dramatic increase in the use rates amongst our young people. The very behavior that we agreed was unacceptable.
And so do you have statistics for that?
Yes.
Or how can you show that?
I can show you local statistics, I can show you national statistics. The marijuana use rates have been held steady for about 10 years. They are now increasing across the country and in our community. Let me make one point, and I find this particularly egregious as it relates to the dispensary model. And this is what it's doing to our young people. In their own words, based on a publication that they've put out, Why Should You Vote Against Banning Medical Marijuana Centers in Fort Collins? It says clearly, under the Protect Patient Access to Safe Medicine, MMCs are safe, secure, regulated, and taxed just like other medical providers. I currently have a father sitting in a hospital bed at PVH under the care of medical providers. I'm very confused, and our youth are very confused when this industry uses the words medical providers. I would like to know what credentialing, how does this become a medical, you become a medical provider? It's a fairly rigorous process to be a medical provider in this country, and yet, in their own words, they are a medical provider that has confused adults, and it's had a profound confusion on our young people, and the increasing use of marijuana, which we agreed was not acceptable, is a result of this confusion.
Okay, Steve and Ken, how would you answer that?
Well, Scoot, I think that you're not having faith in our young people. They're a lot smarter than we think they are. And as parents, we spend the time talking to our children and explaining to them what goes on in this world. There's a lot of things that I don't agree with, and we've had numerous conversations. And Steve and I, we've come together and created the Fort Collins Medical Cannabis Association, and we've got a lot of the business owners involved in that. And we've critiqued advertising, and we've critiqued things, and we want to continue to work with you. And we hope after we win this election that we move forward and we create more regulation if necessary to satisfy this community. We need to work together, and we need to educate our young people, and that's the way that we'll keep them from using substances.
Can we try to educate our young people? I would suggest that we have tried to educate our young people in a variety of ways. Every time we put out some form of education, which is fact-based, evidence-based, in the research, we at Team Fort Collins get incredible amounts of email from dispensary supporters who call us liars, all kinds of names. Every attempt we make to give bona fide education, we are accused of lying to our young people. It's very difficult to educate under those. I have never in my life experienced the kind of verbal abuse from this community after serving in this community for 35 years with young people in the best interest of young people as I have since this issue has come forward. Having said that, I'm willing to do that. My job at Team Fort Collins is to secure the effective prevention methods to keep our young people substance free. And I must tell you, let's be honest, the access to marijuana in this community is over the top. The perception of harm amongst our young people is dropping like a rock. It's common sense, gentlemen, that we will have increased use among our young people, and you agree that's unacceptable. And I would suggest that the dispensary model and the National Institute of Drug Abuse supports this. SAMHSA supports this. Every major federal government agency that researches this supports this. When you have a dispensary model in your community, you will see more youth use. And unfortunately, we are seeing it in Fort Collins. And we can talk about revenue. We can talk about tax. The cost of treatment. You indicated there was a tax of $200 and something thousand that was brought into our community. The cost to treat one child for drug treatment is about $60,000 out of pocket. So I would suggest you could treat 4 kids on the revenue stream that you will generate. The social cost to this is ridiculous. We talk about compassion. We have compassion. But let's have compassion for those families that are working and hoping and caring for a young person who has been caught in the trap of addiction. Let's have compassion for those people.
Okay, so
I want to point out, Barbara, the question came out.
Please don't clap. You just take time away. Yeah, you can have it on both sides. I don't want any clapping.
I would point out the question came out of the medical part because it was addressed in their literature. When it comes to medical, having grown up in a pharmacy, my father saw the prescriptions from the different doctors. He spent 6 years in pharmacy school, or 6 years of college to learn that. He looked for drug interactions. We don't see that at dispensaries. They come in for their pot. That's all they come in for. The dispensary owners haven't offered that they have medical training, nor do they know what the other drugs are these people are taking. I happened to talk to a pharmacist that worked at one of the local hospitals in the cancer center. She spoke of the problems that industry creates because the people that come in and they're smoking pot outside the building, inside the building, or outside the building, and they have interactions with other medications. I don't know why there hasn't been a push. If we're going to talk about this being a medication, every other medication goes through a pharmacy. It goes through a prescription, licensed, DEA-approved prescriber. We're not treating it the same way. We simply haven't.
My question then is to Steve and Ken, what kind of training do people who dispense marijuana have so that they know what to give?
For one thing, for a patient to be able to buy from a medical marijuana center, they have to have gotten a recommendation from a physician who is certified by the Board of Medicine of the state of Colorado. Then they have to take that recommendation and apply to the Colorado Department of Health and Environment to receive the identification that allows them to purchase medical marijuana from the centers.
May I comment on that? 15 physicians.
Wait, let him finish.
Thank you. I'm sorry.
That's okay, excuse me. now where was I?
Physicians applying.
Okay. As far as the expertise of the people that are working in the medical marijuana centers, we have a training program in our center. Our people that work in our center become very familiar with the different strains that we have and their uses for different situations.
So self-taught's what you're saying, self-taught through your center?
It's self-taught through our center. The information that is available is information that we glean from sources. This is new. This is a fairly new industry.
And our association, we've retained an outside company called HealthWise, and they're going to come in and help us develop a training program for our employees, because we recognize that we need to take this to a little further level, and we need to make sure that our staff are trained to adequately handle patients.
I also want to address.
Your industry is going to set the standards. It's not. I said.
Wait,
your
one
industry,
at a time.
Your industry is going to set the standards. You're creating your own. We're told what's going to happen. What I'm talking about, when you get 2 prescriptions from a doctor, they go through the same pharmacist. If you go look for different pharmacists or run to different pharmacies, they call it doctor shopping or pharmacy shopping, and people go to jail for it. But what I'm told, there's nothing set up right now that stops them from going from dispensary to dispensary to dispensary. Nobody in the dispensary has state-recognized medical training of any kind that's documented, and they don't know what other medications they're on. Is it responsible to give them one medication not knowing what the others are and not having training or certification and interaction between drugs?
I think that could also happen in the pharmacy model as well.
No,
Okay.
it's set up to watch that. Yours has none.
Okay, you have one more comment?
Yeah, and I just want to acknowledge that the training that can be provided historically has been prevented by the federal government because it's a Schedule I drug. And so that training is prohibited. That research has been prohibited. And so it's been very limited. The training that comes to this industry comes from the underground.
You had an excellent point. Would you disagree this is still against federal law?
No, I wouldn't disagree with that at all.
I think that is a good point that Matt brings up, and Ken alluded to it, for us to work with the dispensary folks, and I consider these people friends. I have no angst against them as people. However, marijuana is a Schedule I drug. It is federally illegal. We cannot, as a recipient of federal dollars, engage in the dispensing or the facilitation of an illegal substance.
But the state law allows it.
Federal
That's
law,
the problem.
Federal law comes before state law. And the fact is, and Matt, if you would support this through your expertise, the fact is, federal law comes before state law. This drug, whether we call it medical marijuana, cannabis, is a Schedule I drug on the same schedule, by the way, as heroin, LSD, marijuana, and ecstasy are Schedule I drugs. That's a
Okay.
fact.
Okay, but the thing that I understand is that the dilemma for everyone is that the state has to allow the caregiver model. Is that right or wrong?
That's correct.
Correct.
Okay, so that really the decision that the people of Fort Collins have to make, and I'm trying to wrap this up because we're getting to the end, is they have to decide if they prefer a caregiver-patient model versus a dispensary model.
Right.
And that's
Yes.
been the essence of the discussion.
The voters approved the caregiver model with Amendment 20.
Right.
The legislature changed that model
Yes.
in approximately 2008. Matt is the expert in that. Our position is that the citizens of Fort Collins have every right, as evidenced by the overwhelming support for the ballot initiative, to have their say in this. Whether or not they choose to have a retail distribution center, 22 of them, 23 perhaps, 20, in our community.
Right.
That's the question.
That's the question. Okay.
Yeah, and-
Yes.
and just to further answer that question, the current legislative scheme or regulatory scheme limits caregivers to 5 patients and 6 plants per patient. If a ban is put in place, Section 25, 1.5106, if you want to look it up, 6A and E, allows the Colorado Department of Health and Environment to issue a waiver in exceptional circumstances, and that's the language found in the statute. And a banned area was discussed at length as meeting that qualification. They can consider the proximity of medical marijuana centers when determining whether or not to issue a waiver to allow a caregiver to have more plants, more patients in residential areas. So.
Thank you.
I think,
Okay, now I would like to go to our final comments because we're approaching our time. And let's see which way. I'll just start with Justin and come around to Steve. And I think you can tell us in 1 minute or less why people should vote for or against this initiative.
Absolutely. I go back to the reality. This is not about medical marijuana. That was approved in 2000. We've honored that law. What we're going is in 2009 when the will of the voters was overturned and dispensaries were put into our communities. It was a huge social issue. The Fort Collins City Council didn't put it before the voters. This is their chance to look at it and decide if being the pot capital of northern Colorado, attracting people to buy and sell marijuana, is the future we want for our children. Do we want to base our economy on selling marijuana to people that come from all around to do that? Or do we want to base it on the things that make us a better community, more healthy, better educated, better employed? Is that the future we want? If so, this is the chance to vote for Initiative 300 and move back to the original caregiver model that was successful. If anybody has a question, what goes on at the dispensaries, who's there purchasing, they're in public places, stand outside and look at who comes through there and judge for yourself. Have you been told the correct thing by the dispensary owners or by the citizens, the Davids of this community, who are trying to stick up for a safer community?
Okay, Ken?
And I have a different outlook on this. This is all about patients, and we need to continue to offer a safe, regulated model for our patients. And I don't know what the other option is going to be. I don't know if you are to ban the centers. We have budget problems as it is, and right now we're a self-funded industry. There's not all of our investigations, all of our law enforcement efforts are based through our application fees. When that goes away, your department's going to have to pick that tab up, and that's going to cost our taxpayers a lot of money. It's also going to impact patients' safety and access to quality meds. You've talked about training and how do we validate ourselves? Well, we have many of the reputable centers in this town have employed people from outside industries, from the gardening industry, to come in and help make sure that we are educated. We have clean organizations. We meet all the requirements for organic or whatever methods that we choose to use. And I just don't want to see that go away. We're not increasing crime in the area. You haven't been able to prove that. You haven't been able to prove that we're increasing marijuana use within our schools. And I just urge everyone to vote against this ban.
Okay, Scoop.
Yes, thank you. One reason it's a self-funded industry is because it's federally illegal. Banks cannot loan to them. It's federally illegal business, and so therefore they cannot claim business expenses against their taxes because it's a federally illegal business. I think that needs to be clear. But having said that, our mission at Team Fort Collins is to secure a substance-free lifestyle for young people. Our work has become drastically different and much more complicated since the advent of dispensaries. Simply put, are we willing as a community to sacrifice the future of our young people for the financial gain of an industry that is federally illegal and has changed the character of this community? We have a vision for this community from polls in Pine Ridge to the nature of this community, and I think the voters have an opportunity on November 1st to vote for this ordinance to shape the future of our community and to secure as best we can a bright future for our young people.
Okay, Steve.
I think that the voters need to understand that there is going to be a certain amount of marijuana consumed in Fort Collins, whether it be medical or whether it be the other. And the best way to keep the marijuana away from the youth in our city is to regulate it and to keep it in a safe and secure location, which this business model offers. I also think that it is to make somebody that has a debilitating medical condition to leave town or to force them to grow their own marijuana is just wrong, and I think that it's not compassionate.
Okay, thank you very much to our panelists, to our studio and viewing audiences. You've all been very attentive. I hope you've learned something about this issue. It's complicated, and you'll get your chance to vote on November 1st. Copies of recent CrossCurrents programs will be rebroadcast at various times during the month on Channel 14 in Fort Collins. Copies of the video are also available at the Fort Collins or the Poudre River Library District. You can check them out at 201 Peterson Street and at the branch at Front Range Community College on Harmony Road. The video is also available on the League of Women Voters website, which is www.lwv-larimercounty.org. And furthermore, I would like to urge you, if you are not registered to vote or if you did not vote in the last election, you must register by October 3rd because you will not get a ballot in the mail. You can check this by visiting www.govotecolorado.com and click on the View Status link. That will tell you if you are eligible to vote, and you will get a ballot in the mail. If you don't find your name there, you better check with your local county or city clerk to make sure that you're registered and if you want to vote on this. So thank you very much for your participation.